Before inserting the guide wire into the coronary artery, the tip of the wire must be slightly bent. This is called preshaping. Place a fingernail about 10 millimeters from the tip of the wire. Then, gently squeeze in the direction of the tip of the wire to form a small bend. The guide wire is introduced into the guiding catheter by using an inserter. When the tip of the guide wire reaches the distal end of the guide catheter, a torquer is attached to the wire. Grip the torquer with your right hand as if you were holding a chopstick and give the wire a rotational directional motion. With the left hand, lightly grasp the guide catheter and use the thumb and index finger to give back and forth motion to the guide wire. After the wire has passed through the lesion, place the wire tip as far distal to the coronary artery as possible. This stabilizes the entire system, and if the wire moves slightly, it will not pull out of the lesion. If the wire is pulled out and repassed through the lesion once it has been dilated, there is a risk of the wire going into the dissecting space. As a rule, the wire should not be removed until the procedure is completed. Before inserting the balloon into the lesion, the air in the balloon must be removed. The procedure shown in the video should be performed several times to completely evacuate the air in the balloon. If air remains in the balloon, it is difficult to determine the dilated state of the lesion because the fluoroscopic image is similar to that of indentation, which indicates insufficient balloon dilatation. After the air in the balloon has been completely removed, the balloon is placed on a wire and inserted into the guiding catheter. The procedure for balloon insertion is shown. When the exit port of the balloon catheter has been reached, switch the way you hold the catheter like this. The inflation device is attached to the balloon catheter when the marker on the balloon catheter shaft reaches the Y connector. Insert the balloon into the lesion. Once the balloon is confirmed to pass to the distal portion of the lesion, it is pulled back and expanded. After confirming dilatation of the lesion, balloon is deflated. After sufficient deflation of the balloon, pull it back into the guiding catheter. I will show you how to remove the balloon catheter. It is very important to perform this maneuver so that the wire in the coronary artery does not move at all.